So this video is going to be looking at the link of drugs within sport. The use of drugs in sport can be known as doping. Okay, so if you see the word doping, it's referring to drugs being used by an athlete or in a sport. So what is doping? Some sports people, so some athletes, they try to gain an advantage by using performance enhancing drugs, and this is known as doping. Loads of performance enhancing drugs are banned by sports governing bodies so that sports are fairer. Obviously it says there performance enhancing drugs, so if the sports people take these drugs, it makes their performance better, improves them as an athlete, and that's why loads of them are banned, to keep sport nice and clean and fair. So if they take a performance enhancing drug, this is known as doping. But why would a sports person consider taking a drug? Obviously to improve their performance, but why? What might be the reasons? What might be the pressures? Just have a quick think. Right, see if you get any of these then. To be the best. Lots of sports people and athletes are super competitive. They've been training for years. They want to be the best. So they might take these drugs to try and get as good as they can so they can become the best football player, the best rugby player, the best sprinter, the best swimmer. Obviously in lots of professional sports there's lots of money to be made. If you win in a competition, or if you win a football match, or if you win a football tournament or sports tournament, there's usually money as a grand prize. Or you might get paid more in team sports. If you're getting paid a salary as a player, if you're a better player, you're going to earn more money. So money and winning money is a big influence. Influenced by others. So you might be surrounded by other athletes, and if some of them are taking performance enhancing drugs, you might be influenced by that. Natural ability not good enough. So you might not be that good, but you know if you take this performance enhancing drug, it's going to make your performance better, and you're going to be able to keep up with other people in your sport. So you might use it to compensate for a lack of natural ability, to recover from an injury. Obviously athlete's worst nightmare is to get injured, so they might use a performance enhancing drug to recover from that injury as quick as they can, as best they can. For publicity, if you get caught with a performance enhancing drug and you've used it, it usually makes big stories in the news. So you might do it for publicity. Meet the expectations of others. If there's lots of pressure on you as an athlete, you might feel you need to take it to meet their expectations. Better results, more sponsorship. We kind of spoke about that in salaries. And short sporting career. It's not like other jobs where you work for 40, 50 years maybe. In a sport career as a footballer, you might only play for 10 to 15 years. So they might want to make the most of it, be as good as they can, make the most money they can, recover from injuries, etc. So the first performance enhancing drug we're going to look at are anabolic agents / steroids. So these improve performance by increasing muscle growth and helping athletes to recover faster so they can train harder for longer. So anabolic agents and steroids, they help athletes recover faster so they can train harder for longer. So if I go to the gym and I lift loads of weights, the next day my arms are probably going to be tired. But if I take these anabolic steroids, I'm going to recover quicker, which means I can go to the gym and train harder and for longer, because I know once I take the steroids after, I'll recover quickly again. And that will allow me to train a lot faster, a lot harder and for longer, which will improve my performance. So what sort of sports might be linked to anabolic agents and steroids? So athletics, sprinting. Sprinting is a really tiring activity to do. I'm sure you know from doing it in PE. So if you could get a steroid that could help you recover quicker, so you can do more sprinting, you're obviously going to get faster. In the gym, weightlifting it's very common in gyms for people to be using steroids because, as it says, it helps increase muscle growth, helps athletes to recover faster so they can train for harder for longer, so they can train their muscles for harder and for longer, which will make their muscles bigger, increase their muscle growth, and they'll be stronger. So example of anabolic steroids are testosterone and nandrolone. So you've probably heard of testosterone because the body produces that naturally, and the anabolic steroid is a way to boost that. But taking anabolic steroids has lots of side effects. So it can cause liver and kidney damage, high blood pressure, acne, which are like, this is a skin condition on your face, aggression, it can increase your aggression, it can create more facial hair, baldness, as you can see by the man there, might create a deeper voice, reduces sperm count, and within males it might lead to the development of breasts, so a larger chest. So there are lots of side effects, and it is a banned drug in sport. What about blood doping then? This is also banned and illegal. It's when athletes use their own blood to gain an advantage. So it's not actually a performance enhancing drug, but it's a performance enhancing method. So what would happen is, say the most famous example is of a cyclist called Lance Armstrong from probably before you remember, and he did lots of long distance endurance cycling. And what he did to try and enhance his performance is they would take 2 to 3 pints of blood from him a few weeks before a competition. They would then process the blood and remove the red blood cells, which we know carry the oxygen. They would freeze those, and they'll put the rest of the fluid from the blood that was taken out back into the athlete. So all they've lost is those red blood cells, the oxygen, the ones that carry the oxygen. The body will start working to rebuild these missing red blood cells when it realizes over time. Then it'll have rebuilt them, so they'll be back to a normal level. And a few days before the competition, the frozen red blood cells, which will obviously thaw out before, are then re-injected back into the athlete. So the number of red blood cells has now increased. So there's more red blood cells to carry oxygen, which means the performer can keep going for longer, because we know that the oxygen provides energy to the working muscles. So if you've got more oxygen, you can have more energy and your muscles can work for longer. Hopefully that makes a little bit of sense. You can pause this, have a look. But it's very dangerous to blood dope. You can suffer allergic reactions. You might suffer a blood clot where all your blood clumps together. And that can lead to heart attack or stroke. You could suffer kidney damage, hepatitis or AIDS, or infections because the blood's been taken out and then it's been re-injected into a needle. If you have a dirty needle or whatever the blood stores in gets dirty, this could lead to an infection. And also, the more blood in the body, the more pressure on the heart to pump it around the body, so that could lead to heart failure. So it's super dangerous to blood dope. Next thing we're going to look at are this is hard to say, erythropoietin, which EPO for short, or peptide hormones, and also growth hormones. So we'll look at peptide hormones first. These are red blood cells. Like we said, they give you more energy because they carry the oxygen. The I can't even say it, but EPO is a naturally occurring hormone, and it makes the body create more red blood cells, as we're discussing, carry the oxygen. So endurance athletes use these illegal supplements to significantly boost their cardiovascular fitness. Until recent times, it has been really difficult to detect and test, so they think that hundreds of road cyclists actually avoided detection for EPO in the 1990s. So although it's naturally occurring hormone in the body, endurance athletes were getting more of it through illegal supplements. And then the next thing to look at is the human growth hormone, or GH, which helps build muscle. This again is a naturally occurring hormone that causes the body to grow, but is used by athletes as an anabolic agent to increase muscle growth. So a bit like with the EPO, they're taking the HGH, they're taking extra of it to increase muscle growth. But that means there's a big risk. If you take EPO, you're putting yourself at risk of heart problems, risk of stroke. It can increase your blood pressure and reduce the body's natural capacity to make EPO. So like we said, it's a natural occurring hormone. The body already makes it. But if you start putting more of it into the body's capacity to produce it might be reduced. So it's very damaging it. Then for the human growth hormone, it can cause abnormal growth, heart disease, diabetes, and arthritis. Next we're going to look at narcotic analgesics. Oh, I can't say these words. So analgesics are painkillers, and narcotics cause delirium and drowsiness. So together they do both, and sometimes referred as opioids because they often contain opium derivatives. These are drugs that are used by athletes to suppress pain, so to hide pain so they don't feel pain, which enables them to carry on even with an injury. So if you've really hurt your leg playing football, but you've got a really important game next week, you might start taking narcotic analgesics because they can hide the pain you feel, which will allow you to play on through the injury. And these are types of narcotic analgesics. Morphine, you've probably heard of that. If you've ever been to hospital and hurt yourself, they might give you morphine, and it makes the pain go away. You can't feel it as much. Heroin, it's a class A drug. Codeine, but it's super dangerous to take narcotic analgesics. They're highly addictive, which means if you take them, you'll want to keep taking them. And in lots of countries, they're illegal, so you can only get them through a doctor. Withdrawal symptoms are very unpleasant, so if you take them, then want to come off them, it can be really horrible, really unpleasant. If you use them, you might struggle to concentrate. It can affect your concentration. Leads to reduced coordination and poor balance, so two of our skill-related components of fitness are affected there. And the pain is suppressed, so performers are making their injuries worse without realising. Because they can't feel the pain, they might be exercising on an injury, and if you do that, the injury is not allowed to rest or heal, so it's made worse. If you've really hurt a muscle, but you can't feel any pain and you keep using it, you're going to damage that muscle and make it worse. And it can cause mental apathy and lack of motivation. And constipation, God, there's a lot of these, isn't there? And low blood pressure. But the key ones there to remember are pain is suppressed, so the performers can't feel their injury being made worse. They're highly addictive, and the withdrawal symptoms are very unpleasant. So learn 3 or 4 if you can. Right, diuretics. So diuretics increase the amount of water passed out of the body as urine. So you take them, and it basically means you go for a wee more, and that gets rid of more water out of your body. Performers sometimes use them to reduce their body weight very quickly before a competition. So can you think of an example where you need to have a specific body weight? Exactly, boxing, MMA, wrestling. For example, a super lightweight boxer might only weigh under 60 kilograms. So if they're 62 kilograms a week before the fight, and they're really working hard and they can't get rid of that weight, they might start taking diuretics to try and reduce it so they can get under 60 kilograms. It can also be used as a masking agent. They flush out traces of banned substances in the body so they don't show up on doping tests. So they might have taken some of the other performance enhancing drugs we've already spoke about. And the diuretics, if you take them as well, can sort of disguise them, make them hidden. So when they do a test, it looks like they've not taken anything. So jockeys use diuretics to keep their weight down. Why do you think that is? Well, they're racing on a horse. The lighter they are, the easier it's going to be for the horse, isn't it? And then, like we said, MMA fighters and boxers to make their weight. But, of course, like the other ones, there are side effects. If you're getting rid of water out of the body, you're rapidly losing water, then you're going to get a lot of side effects that are similar to dehydration, where you don't have enough water in your body. These include muscle weakness and cramps. So an MMA fighter might make his weight, but then in the fight he gets cramp. His muscles aren't as strong, so he might not be able to punch or kick as strong. He might get tired within the rounds, and that's going to affect his performance. Heart damage, obviously very dangerous. We know how important the heart is. Rashes, so skin conditions. Loss of sodium and potassium salts. So these are really important for your electrolytes. Dizziness and nausea, and kidney problems. So are they really performance enhancing? They might help you make a weight, or they might help you be lighter, but they actually probably have a negative impact on your performance itself. Because if you've got all these issues going on trying to do a sport or have a fight